number 1.
Heather Beasley is the recipient of the first Black in Physiology Award. This award will go to a trainee that the Black in Physiology Executive Board identifies as having promise in the field of physiology, who has a passion to see that the younger generation of Black scientists are taken care of and who will make an impact in her field. Congratulations to you, Heather, for being the first recipient of this award.
Thank you so much. Wow, that is exciting. I'm very grateful to the committee for selecting me to give this presentation to you all today. And so in summary, sustained high calcium desensitizes the receptor, and it also promotes tumor cell growth and motility. Now, reduced sensitivity of this receptor actually promotes the development of cancer-induced hypercalcemia, and that is because there are higher set points before you actually have a reaction of this GPCR. Now, this may enable these tumor cells to subsequently survive at high calcium in microenvironments such as the bone. Thirdly, high calcium levels are positively correlated with breast, prostate, and skin cancers in the European descent sample. And lastly, the importance of this is the novelty suggests that patients that have this mutation that also develop cancer may have secondary malignancies. And so it's important for a physician to know that, because then they can provide preventative care. There are more than 4 FDA-approved treatments or pharmacological interventions for patients that possibly might have bone metastasis. And so we're hopeful that this work will actually help in those studies.
We also had a poster competition, and this competition was broken into an undergraduate competition and a graduate competition. You see the beautiful undergraduates on this poster, and we had 12 posters in the competition. Okay, so now I'm going to announce the award winner, and that is Jabria Powell. Congratulations, Jabria. Jabria Powell is an undergraduate student at Tougaloo College in Jackson, Mississippi, and she presented a poster on COVID-19 comorbidities and how it predisposes participants from the Jackson Heart Study to desperate health outcomes. Congratulations, Jabria. We are so proud of you. There were 9 participants in the medical and graduate student poster competition. So I'm here to announce winners. So today I would like to announce that Ms. Adaku Ume, who is a graduate student at Wright State University, is the winner of the graduate student poster competition. Congratulations, Aduku. We are so proud of you. Aduku presented a poster on mechanisms of calcineurin inhibitors and how they induce renal damage. Congratulations. Moving on, we had a graduate student oral competition. And in this oral competition, we had 3 participants, Aduku Ume, Maria Jones Muhammad, and Ubang Ekperikpe. So today I'm here to announce the winner, and the winner of the graduate student oral competition for the first year of the Conference for Black Physiologists is Ms. Maria Jones Muhammad. Maria is a graduate student at the University of Mississippi Medical Center, and she presented a fabulous talk on investigating potential mechanisms for increased seizure susceptibility in the RUP mice. Congratulations, Maria.
Our work is significant because it shows that a reduction in ASIC2A in the hippocampus of RUP mice, in addition to transgenic mice with reduced ASIC2A having increased susceptibility to seizures, suggests ASIC2A having a role in RUP-induced seizure susceptibility. Understanding mechanisms that can result in preeclampsia advancing to eclampsia will aid in the development of treatments for mothers suffering from this disorder. And I would also like to acknowledge my mentor, Dr. Warrington, for allowing me to continue this work, as well as the University of Mississippi Medical Center.
Finally, we had the postdoctoral fellow oral competition. And in this competition, we had 3 participants, Evangeline Deere, Kiana King, and Gwendolyn Davis. I would like to announce the winner of this oral competition is Dr. Kiana King. Kiana King is a postdoctoral fellow at Emory University in the School of Medicine, and she gave a talk on the effect of EGF inhibition on salt sensitivity. Congratulations, Kiana. We are so proud.
Altogether, inhibition of EGF leads to a greater increase in the systolic blood pressure when increasing the dietary sodium intake, regardless of the activity level.
My name is Corey Reynolds, coming to you from Houston, Texas, and I'm the treasurer for the Black in Physiology organization. Lastly, I would like to touch on sponsorship. As Clintoria pointed out, we have held workshops, table talks, a Black in Physiology week, and now a full-fledged conference. And our ultimate goal is to be able to provide fellowships for students on the graduate and postdoctoral levels. However, all of these things require time from participants like you all, but most importantly, they require funds to allow them to happen. If any of you are interested in or know someone who would be interested in becoming a sponsor of Black in Physiology on any level, please feel free to reach out to me at corey.reynolds@blackinphysiology.com. And lastly, I would like to recognize and thank our sponsors and supporters for the inaugural conference for Black in Physiology. Our sponsors have been instrumental in making the many moving parts of this conference come to fruition. And these sponsors include the executive board members, which you see on this slide, the King Law Firm, and lastly, our first platinum level sponsor, Dr. Stephanie Watts from Michigan State University. Our key supporters include Dr. Leo Ferreira from the University of Florida and Doctors Mary Lindsay and Erica Bozen from the University of Nebraska Medical Center. We also would like to recognize Marty Frank, Jennifer Plusnick, Christine DeLeon Pennell, Michelle Gums, and Clinton Webb. We'd also like to thank one of our ally organizations all the way from the United Kingdom. Yes, we are a worldwide organization, and that is the Physiological Society. So again, a most gracious thank you to all of our sponsors and supporters.